The topic of informed consent in the doctor-patient relationship is a very important subject for me, because I believe that in the field of plastic surgery, a lot of things happen that actually go beyond the realm of medicine. So, if you think about why a patient usually goes to the doctor, well, I have some kind of illness or injury and I want to get help, because I'm in pain, or maybe because I have a serious illness. This visit to the doctor is often marked by fear, by concerns, yes, by worry. And the patients who come to us at the Rosengarten clinic, and of course to many of my colleagues as well, they often have something else in mind. For them, it's about the fact that they're actually healthy, but they want to reach, so to speak, a different state of being, a different level of existence. So they are not satisfied with the situation they're in, with how they exist, but instead want to take a step further in the sense of self-optimization, if you will. And that is, in itself, a noble and honorable goal. Of course, there are limits, though, when you consider that, there are technical boundaries. That means some things are simply not possible at all, while other things are very dangerous. So, we have a major psychological component in our counseling. In my view, with today's over-the-top world of social media, self-presentation, and self-optimization, you really can't separate the psychological aspects from the professional ones in our counseling anymore. We really have to take both into account and, most importantly, and this is especially crucial, we need to let both aspects influence our decision for or against surgery. And I don't get the impression that this is always done consistently in Germany or in other countries by my colleagues, or even by the patients. Often, the decision is made in favor of surgery simply because we can do it and because the patient wants it. Whether this actually achieves the goal of having a happy patient, I'm not always so sure. That's why I believe it's extremely important for us as doctors, as plastic surgeons, to really address the question of realistic expectations on the patient's side, and to discuss in detail with the patient, what is it that you actually want? Am I understanding this correctly? Is this something I can solve as a plastic surgeon? And will you be happy with the result? These are the kinds of questions that are always on my mind, and I believe they should play an important role in every consultation in plastic surgery.